Mr. Selmann, this is your 2-minute question. Our state allows the use of automated traffic enforcement cameras at traffic lights, school zones, and railroad crossings. However, the camera evidence may not be used to assist investigators on criminal investigations. Do you feel this restriction is appropriate? Why or why not?
I feel like it is not appropriate. I feel like if you're out in public at this point, in this day and age, with a camera on every cell phone and a camera on every street, that to think that a camera that's flashing because it's monitoring traffic, if it catches you in the commission of some other crime, I don't think you have some expectation of privacy because it caught you in the commission, of a crime. That's just not where we're at technologically, and that's not a. I respect people's right to privacy, but when you're in public, these aren't cameras that are in your home. These are cameras that are out in public intersections, and they should be able to be used to prosecute crimes.
Dr. Manweller, your 1-minute rebuttal.
Yeah, I think this is an area where reasonable people can just disagree, and it's nothing personal. I don't support the cameras at all, to be honest with you, Mr. President. I don't want to live in a society where the state has a camera rolling everywhere I'm going. You know, there's such an Orwellian vision that I'm driving over Snoqualmie Pass, the state is watching. You know, I'm driving downtown, the state is watching. We're taking pictures of you, we're filming you. I don't want to live in that America. I don't want to live in that Washington. So I would just oppose the use of those cameras unilaterally. What's next? Are we going to have drones flying over the state, keeping an eye on us? In California, they fly planes over and they take pictures of your backyard to see if you've added anything to your house, and then they fine you, right? I don't want to live in a world where the state has cameras watching you. It just reminds me of 1984, and I just oppose them in practice on all levels.
Dr. Manweller, your 2-minute question. The past few years have seen reductions in Medicaid coverage for vulnerable populations that include the elderly and disabled adults. How can we best help meet the medical needs of disadvantaged and disabled people in our state?
Well, I think that the disadvantaged and low-income people have some of the same problems that middle-class families have, is that they're looking for access to reasonable cost health care. And so I've made it very clear that I oppose the Obama Medicaid mandate that is coming down the pipeline, and I have recommended and argued, and this is another area where I think Kai and I disagree, and just reasonable people can disagree on this, but it's going to drive the cost through the roof. The Kaiser Institute has said that it will cost $2.4 billion, of which the state will be responsible for $400 million of that. And I don't know where in this time of tight budgets where we can't fund education fully and we can't fund a lot of these other programs where we're going to find $400 million to cover this Medicaid mandate. So rather than focusing on a federal bailout in which they're going to pay for it in the short run and then leave us holding the bag 5 years down the line, why don't we come up with ways to lower the cost of health care so that we don't have to use this, find $400 million in either additional taxes or additional education cuts. So again, I go back to my ideas. Let's go back and look at tort reform. Let's look at providing a differentiated product so that you can buy healthcare all along a spectrum of options. Let's look at repealing the SEND reforms and getting 23 healthcare providers competing for my benefit, for my business, rather than 3 kind of carving up the state into multiple monopolies. Let's buy healthcare across state lines. Okay, there's a lot of things that we can do. How about the reforms that were passed in Indiana by Governor Mitch Daniels, where he had us have private healthcare accounts, HSAs. The cost of healthcare has fallen considerably, and he's expanded it to 96% coverage, and he did it without a government program. He did it through the power of the private sector. Thank you.
Mr. Selmann, your 1-minute rebuttal.
The idea that the money that this is going to cost is not already costing us money is the problem. So talking to Kittitas Valley Hospital Board, half of what they bill, they don't collect. Half. So that's because when people come in and they aren't insured. So that means when you come in and you are insured, that you are essentially paying for, or you're paying private out of pocket, you are paying for that half of people who aren't. And so given that is where we are now, and we're talking about what is actually going to affect people. Yes, there are going to be costs associated with implementing something, but the idea that those costs currently aren't being borne by the people who are insured, the people who are paying, and hospital districts that are paying to keep hospitals around is just not accurate. So it means when you get down to what a person actually pays, if you actually have more people covered and they don't have to generate half that revenue from people who don't pay, that means that your actual rates can come down, but that are much more reflected to your consumptive use of healthcare, not paying for yours and half the rest of the population as well.
All right, at this time, we're going to give each candidate 1 minute to make a closing statement. And Dr. Manweller?
Well, you know, one of the things that Kai and I agree on is that whoever is elected, we're going to have to work with a variety of people on the other side of the state, both liberals and conservatives, west side and east side. And I think that today's debate has illustrated which one of us maybe has the temperament in which to do that. When I arrived here today, I haven't attacked Kai. I'm done with, I'm just so sick of the mudslinging and negative attacks at the national level and at the state level. I came here and I wanted to talk about my views for Washington State and my views for how I think we could grow jobs. And at every opportunity, Mr. Selmann has attacked and made little snide comments, you know, I work for a living and this and that. You know, and I just don't think that that type of, you know, personality is going to be effective over there. You've got to work with other people. I've shown that I can work with other people. I've worked with Democrats at CW. I've worked with Democrats over in Olympia. And I try to present myself in a way that, you know, would be open to all ideas. And I think that today has borne that out. Thank you.
Mr. Selmann, your 1 minute.
I'm just sitting here smiling incredulously that he's taking the high road on temperament. And so it's a politician to stand up there and just bold-facedly tell you that he's got the temperament to do this. And yeah, I am going to call him out and call him out on the truth of what happened. If you want to see what he's talking about, he says, oh, I never said this about dams. Google Washington Times and Matt Manweller 2009, and you can read the article. You can read it for yourself where he says dams are bad policy. And he says, oh, I never said that. He's a politician. I guess he doesn't figure people are going to check up on him. But to sit there and say, he doesn't like being called out by me, and this means that my temperament isn't suitable for it. No, I'm going to call people out when they do stuff. This is a man who literally punched a 55-year-old cancer patient in the face over fighting about politics. Again, you want to verify it? Look in the Yakima Herald article. It's out there to look for. So for him to make this case that this is about temperament, and it's one thing to sit there and smile. You smile at your face. It's just another thing what actually happens in reality.
Thank both of the candidates for their participation and for your interest in serving the 13th District.
This has been a special iFIBER 1 news presentation of the debate between candidates for Washington's 13th Legislative District, Democrat Kai Selmann and Republican Matt Manweller. The debate was held October 4th at Big Bend Community College.